Hey everyone, it is Dr. Pullen here from Superior Chiropractic and Rehab, and today I have a very, very special guest who I have been really looking forward to ever since I was able to get this on the book. We have one of my great classmates, Dr. Jose from Chiropractic School, and then we have the phenomenal Dr. Sam as well. Welcome.
Hello,
Hey,
thank
how's
you
it
for
going?
having
Thanks
us.
for having us.
Hey, no worries. I appreciate you guys taking time out of your busy schedule to sit down and shoot the shit with me. Um, but let's just talk about you guys. Can you guys kind of give us just a little bit about background, what you guys do for your community and what you guys are doing down there in beautiful Florida?
Yeah, absolutely. So for those who don't know, Jose is a chiropractor. I'm a physical therapist. Together, we've partnered to open our own clinic, Fuerza Physical Therapy and Chiropractic, where we join all the pain relieving benefits of chiropractic and dry needling and the body work that Jose does with all the rehab and exercise programming that I bring to the table. And so we have a lot of people that will come to us after an injury and then continue seeing us for like monthly checkups, kind of like a little movement analysis, preventative care to make sure that everything's moving well and no problems arise in the future.
That is great. And you know what's really incredible about what you guys are doing is that that's becoming the new normal nowadays. I know that there is a chiropractor, at least in my neck of the woods, probably two towns over. He just partnered with a physical therapist, and then there's some other ones in St. Louis that are popping up. So this really seems like it's the new normal nowadays. And
Yeah.
I even interviewed someone just like you guys. You probably know them, Jose, Dr. Anderson, Jake.
Yep.
He's partnered with a physical therapist out in Nebraska, and they're
hmm
having crazy success. And it seems like that's really transitioning into the new norm. Did you guys always want to partner up and do something like that?
Yeah.
yeah, pretty much since we first met, we've discussed having a clinic together or a working setting together. That's been probably one of the things that we most talked about when we first met. Was our goals at the end of everything. Because we met while I was still in chiropractic school, and she was already working as a physical therapist. But since we first met, those were probably one of our initial conversations that we had about what's our end goal or what do we see for the next 5, 10 years? What do we want to do?
That is awesome. That's really, really cool. And, you know, like I said, that's something that's really becoming new nowadays, and not many people really know about it because they always think that like chiropractors and physical therapists have to work separately.
Or they
When
hate each other.
Yeah, exactly. It's like I can't tell you how many times someone's like, "You must hate that physical therapist down the road." I'm like, actually, I sent him a lot of people. Like he's just phenomenal.
We're
So
actually friends.
Yeah.
yeah, exactly. It's a great relationship, and which is, you know, probably one of the it probably answers one of the first questions I was going to ask you guys was, you know, kind of starting this new partnership with you two in this new business. What would you say has been probably the biggest myth that you guys have had to overcome with like a physical therapist and a chiropractor working together?
So, I mean, we're absolutely right. The animosity between the two professions. I know I heard it in PT school. I'm sure you guys talked about it in chiropractic school. And so, one of the biggest things that I think working together has dispelled is like for me, with physical therapy, people always think, oh, you have to be injured to see a physical therapist. You have to be like have a severe injury, a surgery, something like that before you really need physical therapy. But by partnering together, we've been able to kind of dispel that a little bit where people will walk in to see him, will come to see him for just little tweaks. And then while they're here, we're like, hey, this is all good, but let's get you in for some exercises as well so we can make sure that this doesn't come back. And it's been awesome. Patients really love it.
Yeah, patients really enjoy having both of us here at the same time. Just one to pick the brain from both of us. Um, Usually in our initial visit, Sam will run them through a movement analysis, strength testing, ranges of motion, so they get comfortable with Sam. Because some people really, if they want to go see the chiropractor, that's all they want to see. They just want to get adjusted and not do anything else. Or they just want to see the physical therapist and not do anything else. Do their 2 or 3 exercises, maybe get a massage, which is what they're very accustomed to, and leave and sit on a table or something like that. With our office, with our open floor plan and having a gym here, rig, weights, They don't get just the tables. They don't see that until they actually go into one of the rooms. So what we try to do is integrate both of us in the first meeting, in the first patient visit. They'll see Sam first. They'll go through some movement analysis. They'll go through some strengthening, some testing and stuff like that. So they get comfortable with her. Then I'll take over and start doing my thing, my chiropractic thing, and then have that both patients see both of us and they get comfortable with us. So we try to break that myth up with that.
Yeah, and even from what you guys are doing, and I've seen this in other models as well, is that what you guys really try to do, it sounds like it really tried to fix the issue, if you will, not put a band-aid on it per se. I mean, I see all the weightlifting equipment behind you, and I absolutely love it. And so from what it sounds like, you guys are really trying to partner up to first and foremost make sure you address the cause, find the actual problem. Because and I'm sure you guys see it all the time, but for my folks, if they have a low back issue, 9 times out of 10, it's not a back problem. It could be a shoulder problem or a hip hop, ankle, what have you. And so you guys do that full in-depth movement analysis, range of motion, muscle testing, kind of figure out what the issue is. But then you also say, hey, we need to fix this. We can't just put some muscle stim on it to make it feel nice and great. The adjustment helps, which is great, but you also need to strengthen the muscles. And that's what really separates you guys apart from a lot of folks who I know that's in that neck of the woods of where you guys are at, which I absolutely love it. Which does beg the question that you must have had probably some folks kind of pick your brain, not just from a clientele perspective, but like students from like local schools who are thinking, I might want to be like a Dr. Jose one day, or it might be like a Dr. Sam one day. Shout at you, pick your brain. And so for those folks who've been like a fly on the wall in your clinic, what would you say has been the biggest piece of advice that you've given them?
I always tell them, don't settle in your profession. I know, particularly in physical therapy, and it sounds like with chiropractic as well, it's very easy to go to a big name clinic where they overload your schedule with way too many people per hour, and you're not able to give the time of day to any of them. And you might have all these good intentions. I know I did whenever I used to work at a clinic like that, where I would want to, but my schedule was just too packed. And by the time I realized it, that client was out the door done with all their exercises, and I didn't get a chance to look at their squat, look at a deadlift, talk about some return to strength items with them. And so you don't have to settle for that. This is becoming more and more normal. And whether you want to open your own practice or work for someone else, those options are becoming more available and more popular. And the people are willing to pay for it. Like they see the value. They're tired of being passed around from clinician to clinician. And they're going to want to start seeking out environments like this, especially if they have big goals of return to sport. Or even we have some clients who are tired of that model and just want to come in because they aren't getting paid attention to when they're doing their exercises, and their exercises are never progressing. And they know they're going to get that attention here.
Yeah. I mean, I've always joked around with that business mindset that it's like a mill, right? You bring somebody in, if you will, they're kind of like cattle. Just bring them in, lay down, crickety crack, go do your 2 exercises that no one's going to supervise if you're doing it great or whatnot, and then walk out the door. Oh, be sure to pay your copay too before you leave. It's a shame because exactly what you're talking about. It is, forgive my French, it's piss poor care, and it's not necessarily getting great results. Even a lot of the studies coming out say, hey, this model isn't working. Like, great, like, sure, it's great for business, don't get me wrong, but at the end of the day, we're not getting great clinical outcomes, which just doesn't make sense to go in that environment. And what you guys do is that one-on-one attention, which is really what the person needs. And I've seen it myself here in this town. People will pay for that value because they see the value in it from what you guys mentioned. Now, you guys have probably been through some ups and downs since you opened up your practice, right? We've all have. I can't tell you. I thought my wife was going to strangle me when I told her I was, hey, well, I'm going to be up at practice. Hope you're cool with that.
It does come with some strains.
Exactly. It really does. And that's just part of the journey. It's like a roller coaster. I tell anyone who comes and talks to me, some days we'll have some ups, some days we'll have some downs, and that's fine. That's just the way it is. So what would you say, since you guys have opened up your practice, has probably been like the biggest lesson that you both have learned?
Oof.
So many.
I know. That's a good
Um,
question.
I'd say the most widely applicable one that I've noticed is if you take care of your body, it will take care of you, whether it is the stress of opening up a new business or the stress you put on yourself in a workout, that all builds up and it all weighs on the CNS. And so if you take the time to take care of your body, do some light movement if that's all you're able to do, work on your mobility, whatever you feel that you need to do to take care of your body, then it is going to make sure what needs to get done gets done.
It's just like how we were in school, man. We they put us through the ringer in school, so you got to have some good time management when you want to open up a clinic or do something like this. You gotta know your goals. You gotta set some short-term goals, some long-term goals. What do you want to do in this first week? What do you want to do in this first month? What do you want to see in those days that are coming up, so you can work towards those goals. So time management is a big thing. Getting your sleep, you're eating right, and not just focusing on the business, but also focusing on yourself is very, very big if you wanna survive the hardship days that you're gonna have, because every business has them. You're gonna have your ups and downs, but when those downs come, focus on yourself a little bit, take a breath, do something you like, and then get back on the grind for sure.
Yeah, exactly. Because I mean, you two are small business owners, and that's just a challenge in itself, marketing, financing the place, getting people into the door. And then once you're in the door, it's like, oh, I got to switch my brain from business person to doctor. And that can be a lot, absolutely. And that's just one thing I really appreciate about you guys is that speaking from some of our classmates, Jose and Sam, I'm sure you could probably talk about the same thing, is that it's scary starting out on your own.
Yeah.
You get some sleepless nights for sure.
Oh,
You
yeah.
you don't sleep some nights for sure.
Oh yeah, man, for sure. And it really takes some guts, some grit, and just a tad bit of courage just to
Yeah.
make that jump. But at the end of the day, you get to work for yourself, make your own schedule, help people how you want to help them, and then have a financially rewarding career that's going to last for you guys a lifetime. And that's something that a lot of people just don't see because they want to see that immediate return. And that return might not happen for a year, 2, 3, 10 years, however long it
Yeah.
takes.
Right. Exactly.
So I absolutely love it. And I know Sam, we've talked a little bit about it with advancements in the profession, how some people are trying to change the mindset to standardize healthcare, right? Because insurance reimbursement isn't getting any better. Quality of care based on that reimbursement is unethical. And you're really trying to advocate that way is like, hey, we're going to put our foot in the ground and say, we are going to do what we feel is best for this person, not
Mm-hmm.
what Uncle Sam feels or what big CEO of Big Pharma thinks. And that is something that's really, really huge. Have you noticed that that sort of advancement, and Jose, even in your neck of the woods with chiropractic down here in Florida, have you guys noticed that same movement when people are kind of slowly transitioning out of the insurance game to more of that cash-based practice?
Yes, absolutely. And one thing I've noticed a lot of, and even in like those PT mill settings where, like, I know a couple people who are still in that setting, but overall, I feel like the profession is doing a lot less fear mongering. And you find it more in like these smaller private based clinics because we're the ones that decided we're tired of that and need a better change. But quite frankly, the people that we work with are mostly barbell athletes with CrossFit, powerlifting, bodybuilding. They're tired of being told like, oh, you should never be lifting. That's way too much weight. That's not a safe movement. They're tired of it. And so that's one of like my favorite changes in this profession is that we seem to be shifting away from that. And it's awesome to see.
Yeah, absolutely. And just talking with some of the CrossFit guys in this neck of the woods here, they're like so back in the early 2000s from what they told me is that their first line of thought was like, okay, ibuprofen, Tylenol, injections, maybe get back surgery, whatnot. And now that knowledge is coming out nowadays, it says that like if I have a back pain, the first thing I should do is probably get up and walk around. I shouldn't be sitting on my couch all day as a couch potato because that's just going to make it worse. So you guys really have that large educational component to it. And I always see you guys on Instagram going out to different events and just promoting your business, but also giving some treatment to some folks who desperately need it. And I just absolutely love what you guys do for your community. Um, and I know I'm taking up quite a bit of your time because you guys are busy bees down your neck of the woods, so I won't take up much more of it. But Jose, I want to ask you this question directly, and Sam, please jump in if you want to add a thing or two to it as well. From chiropractors per se, I know there's a saying that chiropractors eat through young, right? They will chew you up and spit you out so quick it doesn't even they won't even think twice of it. So, have you guys ever experienced something along the line of that in your neck of the woods that like you've heard a horror story from some of your colleagues saying, you know what, I used to work for this guy and it just burnt me out to the point that I want to leave the profession altogether.
Yeah. Well, it happened to me. When when I started, we didn't open this business until a couple months ago. So my first year out of chiropractic school was working for someone, and all they would try to do is fill up the schedule for the most part. And I'm just going to talk about my experience. It was tiring. I had to drive 30 minutes to work or 40 minutes to work from 7 to 7, 12 hours, maybe 2 hour lunch break. And then on every 10 minutes, 5 to 10 minutes, I would see someone new. And then you would have to do the notes on top of that, which you know about. So they're very big on their notes, especially down here. We do a lot of personal injury. So car accidents, slip and falls. And those notes are at least 10, 15 pages long of just notes and notes and notes. So it happened to me my whole first year where I was just like, this is so tiring. I don't want to do this anymore. I don't even know the person's real name or anything like that. Like, it's very quick. It was just me adjusting them and then getting onto my notes. So most of my day was actually sitting on the computer doing notes and not actually treating patients. I would have a CA and someone else do everything else, and they would just walk into the room, tell me their name. I would look at their note, adjust their segments, and then they would go on their way. So it really got to me my first year, and I was like, this is not what I signed up for. This is not what I want to do. This is not what I paid my tuition for at school. I don't want to. I was stuck, and then that's when we just decided to take the leap and just were like, hey, we're both tired of working these mill jobs. I know they make really good money, but we want to do something for ourselves.
I will say I had the very unique experience of graduating in December of 2019 and starting to work full time at like the end of January, beginning of February 2020. We all know where that's going. So I think I worked for maybe a month and a half full time. There were a couple afternoons a week. I was the only one there, and they stacked my schedule, new grad, fresh out of college, with 3 to 5 patients in an hour. And that was not sustainable. By the time there was talk of like closing for 2 weeks for COVID, I was ready. I was like, wait,
I get a vacation.
Perfect. I'm out. I'm ready. And then because I was the most recent hire, I was the first one to go. They didn't hire me back on until June, and I just had a terrible experience with that, where they were only giving me 10 hours a week. That was not sustainable to pay my rent. They had hired another person on top of that to fill more openings while I still wasn't full time anymore. And it made it very clear to me very, very early in my career that I was just a number to them.
Yeah.
Like they did not care about me, my ability to make a living at all. It was all what they could profit over. In that COVID time, they raised our productivity from 13 patients a day to 15 patients a day, basically making it so that I couldn't come back because the clinicians there weren't meeting their productivity, which they raised to not bring me back. And so that was the point for me that I was like, I need to open my own practice because I'm just a number to anyone else. And so from that on, I met Jose, and started working towards that with everything else. I started my own Instagram account to kind of build a little bit of a following and kind of promote myself that way on social media to eventually get to the point that we're at today.
I love that. That is great. And I've heard that same horror story, not just in private practice, but even in hospital settings too, for physical therapists. One of my good friends, she's a physical therapist for the emergency department in Barnes Jewish in St. Louis. And she was telling me a story about how this woman broke her pelvis, and she was there for like maybe a week or two, and the hospital wanted to go like get released from care, and this girl couldn't be weight bearing. She couldn't move. She couldn't do anything. She lived by herself. And this PT is like, there's no way in hell this gal can go home by herself. Like, what are you talking about? And so they got someone else to above her to sign off of it. And then she was released, and then they fired her right then and there.
Oh my gosh.
Yeah. So it's a real cutthroat environment with something like that, because it's from exactly what you're talking about. It's all profit driven. They don't give a shit about what the patient wants, needs, or desires are. Oh man, I feel like we can go off on a tangent and just have like a
Oh,
3 hour.
that is a rabbit hole that I'm ready for.
I hear you there, man. I hear you there, but
Dedicate the full 45 minutes.
I know, right? But and then again, that's just something that I really appreciate about what you guys are doing, is that you're not accepting that norm and going in a different direction that's going to be better for your clientele. And I tell you what, we're really learning a lot about Dr. Jose and Dr. Sam, about the clinicians, the business folks that you guys are, the marketers, how you help your community. But we also want to know a little bit more about the person. So I got a couple more questions for you, then I'll let you two sneak out for the day. So my next question would be, nowadays, it seems like a lot of people are constantly reading books as often as they can. I mean, I even heard a stat from one of my good mentors saying that the most successful CEOs, the ones that run like Apple, Microsoft, Coca-Cola, those heavy hitters, they read 60 books a year. And if I had to, I can't math like that. What's that, like a book and a half a week or something like that?
That's a lot.
It is. It is. And then, I mean, it can't be like those thick books. It has to be like a 50-page or 60-page book. Nothing crazy. But anyways, what would you say your top 3 books would be, and why?
Let's see, I'll go ahead and start.
She'll do one, I'll do one, and then
one of my favorite ones that is, I recommend it to just about everyone, is called Roar by Stacey Sims.
Okay.
And I recommend this for all women, and then anyone training women. It goes and it takes like a deep dive into our physiology and our nutrition, because so much research is based on men, the 18 to 25-year-old man, and women are often neglected because menstrual cycles really mess with that. And so what Stacey Sims has done is really, like, she only researches women and produces this research throughout the women's lifespan, diving into what our needs are based on where we are in our life, whether we are in like childbearing years, premenopausal, menopausal, postmenopausal, and breaks down how that affects athletic performance and what you need to do to be able to recover wherever you're at in your cycle to perform your best. And I recommend it to everyone who works with women or is a woman trying to compete.
Yeah, one of the books I read recently was, I don't want to say the real word, but it's F Insurance by Danny Mata. I don't know. It's it's a book about his life and how he was in the same, he's a physical therapist. He was in the PT mill workstation, and then he shares with us how he transformed his life and how he became to doing what we do now, a cash-based PT hybrid in a gym type setting. So he gives you a blueprint of how he did it and how it would help you. So we both read that book, and to try and just not model, but take some tidbits from him and learn a little bit more about this cash-based hybrid setting, which is what we do. So he was a good book that it's a very short book. It's not very big, about 100 pages, I think, about 150 pages. But he breaks down everything from marketing to how he writes his emails to people, how he gets people in the door, how he does his workshops. So it's a very good book if you want to get into like the cash-based hybrid type setting like we're doing right now, that's a very good book to read.
I think that's what I would definitely both recommend for anyone who's trying to get into this space. It helped a lot, and we still look back and reference it whenever we need a couple little tips.
Yeah, and it's a very easy read. It's not like very difficult read. It's very easy read. I did like a couple chapters. Every time I had a little break, I would do a chapter or two, and then it was a very easy read throughout a couple of days.
So what you're telling me is that I could read the book.
Oh, you would
Oh,
love the book. You
yeah.
would love the book. It's a very good book.
Just because it's written by a PT, like it is great for anyone in like conservative care model trying to like catch patients.
That is awesome. Perfect. Okay. Well, even with, a lot of people reading a lot of books lately, even some folks, they're just popping on a podcast when they're going on their 45-minute drive to work or something like that too. And I imagine you guys listen to quite a few. So what would be your top 3 podcasts that you'd
Sam is a
recommend?
very advocate of podcasts. She loves podcasts. Wherever we go, Sam is on a podcast. If we're driving, she puts a podcast on. This is her topic. She is very happy about this. This is her topic.
Yeah.
Well, let's hear it. What do you got?
All right. So for the clinician, there's one called PT on Ice. It's by the Institute of Clinical Excellence. That's the company I get all my continuing ed from, just because they're very fitness forward and encouraging of movement everywhere. Theirs is great. It's like 15 to 20 minutes every morning. And I've gotten a lot of tips. They'll break down research. They have like Leadership Thursdays where they talk about a lot of things, anything like administrative, and it usually brings me like a lot of help with like the business administrative, inspirational side of the clinic. They talk about like geriatrics, pelvic floor, they have fitness Fridays, and like really diving into all the aspects of care that you might see anywhere, whether you're in acute care or outpatient. There's little nuggets that you can pick up from all of that.
Just to piggyback on that, because it is a PT, I've actually taken a course from them. Being a chiropractor, I went to one of their courses, their fitness course, where they break down like all barbell movements and CrossFit. It's a very good course. It was a 2-day course where we just dove into like the squat, the deadlift, the how to do a pull-up. They really broke down everything in that aspect on how the faults that we see in those kinds of people in squats, in deadlifts, how we could correct them. So it was a really good, that podcast, they do it on Instagram as well. It's a very good podcast if you want to learn about just a little tidbits about fitness, about the business side of it. They do a lot of pelvic floor, dry needling. So it's a very good podcast, and their courses are as well. Even being a chiropractor, I learned a lot going to that course. I took that course around 2 months ago, and I was the only chiropractor there. I'm not gonna lie, the only chiropractor there amongst 50 physical therapists. I stayed in a corner for a bit, and then I was like, I'm a chiro, and then everyone just huddled around me, and we were just going back and forth from just trading information on how many patients do you see, what kind of patients do you see, why did you take this course. And they were very friendly. They were very open. We just had great conversation on how physical therapy and chiropractic mesh, and they love what we're doing down here in Tampa as well. So that is a very good podcast. She'd go on with the second one.
And probably one of my favorite podcasts right now is called Tooth and Claw. They go into animal encounters. And so like the guy who runs it, his name is Wes. He works in Yellowstone National Park as a ranger, has a lot of stories, because bears and sharks are very prevalent and we have a lot of negative encounters with these animals. Those tend to show up on the podcast a lot, but what he does is break down like, okay, so here's what happened. It was terrible. It was horrible. These are the injuries that happened. Here's what could have gone better to possibly prevent that attack. And so while I'm not in Yellowstone hiking amongst the grizzlies, now I know what to do if I should come across one. And so it's really cool and really educational. And they do a lot of work and like talk about like what we're doing to like mess things up for whatever animal they're covering that day. They just released one about tiger sharks in the Bahamas, and like normally you wouldn't have one. Like they're normally like not, they don't attack a lot. Like there's a whole like little tiger bay where you can swim with them, and like out of nowhere this happened, and so they tell you what to look out for, or what you can do to prevent an attack, how you can fight back, if you should fight back, and stuff like that. And so it's been a really good one, and I think they're really funny too, so that helps.
She's the podcast queen. And then
Oh.
third, Superior Chiropractic and Rehab's podcast. Obviously, they're doing a great job of just spotlighting different types of people, physical therapists, chiropractors, nutritionists. Dr. Brad is doing a great job of just highlighting his community and other communities around him. And he's doing a great job. We love listening to him. And thanks for having us, for sure.
Hey, no worries. I really appreciate that shout out, man. It means a lot. And I'm just really, like I said, I'm really thankful that I was able to get you guys on here, because what you guys are doing is really unique and different, and more people need to know what you guys do to help out your community, but also to kind of mimic that model into different areas of the country. Like I talked about, Jake's doing something like that out in Nebraska. I'm doing that here in Glen Carbon. You guys are doing it down there in Florida. So it's growing, it's gaining momentum. It's just we need to keep advocating the masses about the benefits of it. So I've taken up so much of your time, probably too much of it, to be frank. But like I said, you guys have been just awesome, and I really appreciate you guys just talking to me and shooting the shit again. I mean, Jose, it's crazy to think that'll be almost 2 years since we graduated in April.
2 years, we graduated. We lived together. If people don't know, we lived together for a time as well. we were together for about 3.5 years of our lives every day.
It's so weird to think that we haven't been in the frat house in so long. Because I was even talking with what was it? I have a podcast I'm doing with Xtina in a few weeks, and I'm sure she's like, I haven't talked to you in like almost 3 years. This is weird. I'm like, it is weird. We should do this more often. But
we talk a lot. We're in the fantasy football league. We got a lot going on. Like we're still from classmates. We're still pretty close. I think we fight more than we talk, but we always have something going on between us, either fantasy football or just random texts on Instagram that you send me or I send you about one of your posts or something like that. So we still have a pretty good communication relationship for sure.
Oh yeah, man, for sure. And I know March Madness is coming up, and I can't wait to take your money again this year. So I'm looking forward to that.
He hasn't won in 3 years. Don't let Brad tell you he hasn't won fantasy. He's been in last place, I think, the last 3 years in our league. We've had this league for 3 years, and Brad's never come in first. So please.
I have never come in first. You are right there, man. I'm struggle busting when it comes to that. Oh man. Oh man, this is awesome. But hey, man, I really appreciate you and Dr. Sam. You guys are really awesome. I won't take up much more of your time, but if anybody is listening to this and they want to know a little bit more about what you guys do for your community and how they can get a hold of you, what would be the best way that they could reach out?
Absolutely. So we are very responsive on our Instagram. That's usually how most people contact us. Our handle is at Fuerza Physio in Cairo. And then you can find both of our personal pages from there as well. We respond. A lot of people will inquire any questions that way, or you can email me at sam@fuerzaphysioincairo.com.
Yep.
Sounds great. Well, you guys heard it from the two pros themselves. They'll definitely be able to help you out. And if you have any questions or concerns, don't hesitate to reach out to them. This is Dr. Poland from Superior Chiropractic and Rehab Radio. Thanks so much. We'll see you guys then.
Thank you.
Thank you for having us.